Welcome back. The next session is unlocking the value of health data in the international R&D projects, enabling fairness and expanding opportunities for secondary use. It's my pleasure to introduce you to the two moderators, both of whom are from the ECHAlliance, and I take great pride in the fact that it's two very capable ladies to whom I'm entrusting you all. So Federica holds a bachelor's degree in international relations and a master's degree in innovation management. She's responsible for communication, dissemination, and exploitation in EU projects. She is a native Italian based in Barcelona. And then Natalia is a senior innovation project manager, has a degree in economics and trade at the University of Rome. And she has over 20 years experience of complex ICT research and development projects. So without any further ado, I will hand over to the two ladies. Thank you.
Well, thank you, Vladin. Good morning, everyone, and welcome to the session. It's my pleasure to introduce this panel discussion today. So what is the purpose of this session? The purpose is to explore the immense value of health data in international research and development projects. We will discuss how making data fair, so findable, accessible, interoperable, and reusable, helps not only advance medical research and improve healthcare systems, but also in bringing global benefits to public health. A key focus of our discussion will be the secondary use of health data. This means using health data for purposes beyond its original collection, opening up new opportunities for research and innovation. We will also make reference to the European Health Data Space, these important initiatives fostering cross-border health data usage and its role in innovation and collaboration in healthcare. As we navigate these exciting possibilities, we need to give priority to data privacy and ethical considerations, as well as the importance of the role of citizens for advancing scientific knowledge. So we are joined today by a great group of experts, each of them bringing unique value into the world of health data. So allow me to briefly introduce them. We have Christian Muehlendyck, I hope I pronounced it correctly, Scientific Partnership Lead EMEA at Johnson & Johnson MedTech. Vasiliki Tsiompanidou, Legal Researcher at ECHAlliance and Gatekeeper Project Partner. Nicola Ferro, Full Professor at the Department of Information Engineer at the University of Padova and Brainteaser Project Partner. Lorenzo Gios, Project Manager at Trentino Salute 4.0, the Competence Center for Digital Health of the province of Trento and ValueCare Project Partner. And last but not least, we have also Jess, Vogt, Research Consultant and Empirica, Communication and Technology Research, and Gravitate Health Project Partner. So thank you all for joining us during this session. And before giving the floor to my colleague Natalia Allegretti, I just want to remind you about the possibility to type your question in the platform, and we will answer them at the end of the session. So now I give the mic to Natalia to start this discussion. Thank you.
So thank you very much, Federica, and a very warm welcome to all of you also from my side. It's a great panel as we represent different aspects that pretty much impact the concept of data sharing and the big value that this data have got in the health care sector. And I would like to start with Christian to have a sort of first industrial, let's say, overview about this topic, as in fact the healthcare one is one of the most data-rich industries which is present right now in the world, although challenges in data sharing are still really present. And from a health industry perspective, what does it mean to embrace and to adhere to fair principles? And do you believe that a data-driven innovation approach can lead to a more democratized and also personalized medicines approaches?
Thank you, Natalia, for that great question. I think fair is absolutely essential. I mean, we live in an amazing time in healthcare where data is increasing exponentially, and that data will allow us to drive advancements in healthcare that we've never seen before. We might even get into the era that we can really look into healthcare and not drive forward sick care as we do at the moment, where we actually treat patients that are sick. However, data is one thing, and the true value of data is the insights that we can get from it in order to identify new opportunities. For that, we need to know where the data is. So it's really about finding the data, making it findable. So it's really essential to have that aspect. And once the data is found, and we now as researchers, and I'm talking here about academic as well as industry, because we're driving definitely in the same direction. How can we access the data? Lots of discussions are going on continuously, very rightly so, related to GDPR and alike, how to access the data in a very good and compliant way. And I think fellow speakers within this call will address this more. And I think the European Health Data Space will help us a lot to take a major step forward from that one. But once the data is accessed, is it actually interoperable? I mean, in order to really drive innovation as we see it, it needs to be machine actionable without human intervention to really get all the insights into a lot of data that is out there. And that leads to really making it reusable for a novel assessment, novel application. And when that is the case, and that's, I think, where fair data plays a significant role, or is the prerequisite, then this will significantly accelerate the classical pharmaceutical and medical device development on one hand, because these insights will help us to address new opportunities, but also very much so going in a new area where we talk about data-enabled healthcare solutions, that the data is really driving those solutions and leading to new treatment approaches. And with that, I'd like to then move forward to your second part of the questions about democratization of medicine and personalization in healthcare. I mean, just as in any other areas that we are surrounded with, the innovation in medicine is increasing at incredible speed. That automatically leads to more and more specialization. And one study impressed me a lot, and you can have the data up and down, but it was stated that in the US, for example, 60% of all lung cancer patients, as we speak, are not treated optimally. But this has not to do with the fact that they are incapable clinicians, quite the opposite. Treatment of lung cancer, and I think you can take it into any kind of pathology, has become more and more complex. So you have more and more specialists. And by the pure nature of specialists, they are less specialists, obviously. And I'd like to compare the new digital era in medicine really with the automotive industry. I'm 100% sure that none of us have really become better drivers in the last couple of 10 or 15 years, but there are less and less accidents. Why is that the case? Because there are digital support systems that help us in critical situations, and this led to an overall improvement of drivers. And I'm very sure that the same applies for medicine. With the new solutions that are moving forward now, data-enabled, faster and more accurate diagnosis is possible, better treatment and recommendations and approaches are possible for both. And I think that's really important, both for the specialists, but also for the non-specialists, and thereby leading to easier and quicker access and a higher level of medicine for more patients. So that's really the democratization of medicine that I would see from that one. However, this is only possible if access to data is available, and this is only possible with fair data principles. And typical examples are the algorithms that support radiologists or dermatologists today, but also very much solutions such as robotic-assisted surgery. And this then automatically leads, if we have better decision-making, leads to personalization and customization of medicine. If personal health data can be taken into consideration at a much different scale than it was possible up until now, thanks to the digitalization and access to data, this will enable really better care at the right moment for the right patient at the right time. And there has been a recent study by Stanford that said that tailored treatment approaches, that's their estimation, can decrease healthcare expenditure by 9%, And what is much more important is apparently increasing up to 1.3 years of average life expectancy. And all of that based on data, and without FAIR, we would not get anywhere because it's all about the insights and not the data itself. So this would be my quick consideration why FAIR is so important and crucial for research, and then obviously for the implication for the patients and the healthcare system.
Thank you very much. Very, I mean, it has been a great overview, and obviously we are touching base on some really critical aspects related to accessing data, specifically when we talk about personal health data. And so I think that a legal view related to privacy and security and to the respect, let's say, of the person that is sharing his or her data is essential. And so my question is going to be for Vasiliki, given her legal background. I mean, when it comes really to sharing personal data, privacy and security, respecting privacy, security, confidentiality, it's more than evident. Even yesterday, some speakers have mentioned the European Health Data Space, which is ongoing in this moment. So I would like to have your view on how this initiative is really addressing this very sensitive issue. And I don't know if you can also anticipate something related to this new regulatory framework in relation to data sharing for research purposes. Vasiliki, please.
First of all, thank you for the wonderful questions. Indeed, as health data is considered sensitive data, it requires a higher level of protection, especially when it comes to its privacy and confidentiality. And so far, it has been the GDPR that has been the main legal instrument in order to ensure this protection. But this is where the EHDS, I would say, comes into place, because the GDPR is based on privacy, while the EHDS is precisely focused on balancing health data and, of course, balancing fair data with citizens' rights. Through the creation of this health data space where data interoperability, security, and privacy are the main requirements, I would say there is a twofold result in a sense. On one hand, data can now be reused in order to benefit the society as a whole and facilitate very valuable research in very important fields like health and medicine, while at the same time patients are actually more in control of their data than they were before, and they can exercise the rights that the GDPR gives them more effectively. They can more easily access their data, they can restrict access to it, they can rectify it and even transfer it much more effectively under the new framework. Of course, any data sharing that is performed within the HDS framework must be performed in a secure environment, which abides by very high standards of security and privacy, and of course, always promoting data anonymization. And this is exactly the points that we have also faced in the Gatekeeper project. Just to give you a very brief background of it, Gatekeeper is a multicentric large-scale pilot envisioning to create, well, it actually has been created at this point, but the goal was from the start to create a platform that will connect healthcare providers with businesses and elderly patients in order to improve the health and well-being of elderly population and aging population. And of course, this ecosystem has been designed in complete alignment with all of these privacy requirements, and it is really exploring how to bring trust and explain to elderly citizens that this solution is actually a good step forward. And of course, in order to do that, you need to demonstrate compliance and you need to inspire this trust, which is why it is also going through options for certification and demonstrable compliance. And of course, the Gatekeeper project has been designed based on the GDPR, but it is already envisioning the HDS, which is meant to facilitate all of these procedures, and in particular, the secondary use of data. So far, the GDPR has been defining how to reuse the data for research purposes on the basis of Article 89. But the issue with Article 89 is the fact that it leaves it to member states to define exactly how and under which conditions data can be reused for research purposes. As you can imagine, this leads to an immense lack of homogeneity and legal certainty, because each member state has chosen to address this exemption in a different manner, sometimes even choosing to reconsent the patients, which, as already has been discussed in other sessions, is not always feasible or even possible, not to mention that it can lead to biased outcomes. And this is actually where the ECHDS brings a crucial step forward, as it introduces a legal obligation to share data and make it available. This means that organizations in possession of data, of health data, can now use the legal basis of compliance with the legal obligation in order to share it and reuse it. So the process under this new framework is actually based on a data permit that is filed by any interested party. Of course, access to the data is only granted for very specific purposes, research being the main one. And if all the conditions are met, access is granted only in closed, secure environments without revealing the identity of the individual. Of course, if someone is to extract data from this environment, this data needs to be anonymized. And this is where I would like to close, circling back to how the data subject rights are actually enforced through this framework. The health data access bodies that will be in all of the member states have increased transparency requirements. They have to publish information on all the applications that they actually have received and granted, and they are also compelled to publish information that might affect citizens' health, if any findings were actually arising through this research process.
Thank you very much, Vasiliki, for giving this great overview. And yeah, so there are big willingness that this new regulation will be soon put in place. On one side, to really protect people's rights, as you have said before, but also to give a new boost for advancement in healthcare related research. And for sure, I mean, the quantity of data which are present in the healthcare domain is huge, as also mentioned with Christian before. And even almost 20 years ago, you might remember that Clay Hamby stated that data is the new oil, but unlike oil, that is not finite, you know, but can be reused. And also taking into account what Vasiliki was saying in terms of share the data, reuse the data for research purposes in a protect environment, etc. Nicola, given also the collaboration that we have in our Brainteaser project, how do you think that we can really unlock the value of healthcare data for their secondary use, and how much you believe that a collaborative environment to assess available data sets can really enhance the overall performance of research and innovation in this field?
Thank you, Natalia, for the question, and good afternoon or good evening, depending on where you are in the world, to everybody. So I think all of these can be, let's say, framed into a broader perspective into open science. I mean, the FAIR principles, the need for sharing data is basically part of open science, which is a set of principles and practices that aim at making scientific research accessible for everyone. And this should be a benefit not only for scientists and researchers, but also for the society as a whole. And examples of parts of open science is use open licenses to share publications, data, software, and so on. And the other key aspect of open science is that the scientific knowledge should be accessible, but also the production of the knowledge itself should be inclusive, equitable, and sustainable. And this, for example, leads to the idea of citizen science, so the active involvement of citizens. Why I'm mentioning all of this? Because FAIR principles and sharing data are one enabler of this vision. An enabler that needs to be somehow gained, because FAIR principles require specific actions to be implemented and to be effective. I mean, findable, accessible, reusable, identifiable. They basically require that you have metadata describing the data, and these metadata should be human and machine understandable, which in turn calls for the use of formal languages called ontologies in order to describe the data. And this requires a strict and cross-disciplinary collaboration, because we, as computer scientists, may be able to design ontologies, but we need to work back to back with domain experts to have the sense of the ontology we are creating to ensure and validate the ontology we are creating. So we need really a close collaboration. And basically, this is what we have done in the Brainteaser project. The overall goal of the project is to develop algorithms to predict the progression of ALS and MS, but much of this is based on sharing data, retrospective data about ALS and MS patients. And so we designed an ontology back to back with the medical doctors in the consortium to represent in a joint fashion retrospective data for ALS and MS patients. And then we used this ontology also to ensure the quality of the data, curate the data in order to avoid missing values or errors in the data. And all of these led us to share the data through open challenges, which are basically open competitions where all the research groups can freely participate, use the data, train and test their algorithms, and accelerate knowledge transfer, because at the end we organize a workshop and each one presents their results, and since they are done on the same set of shared data, they are comparable and each one can understand what are the best approaches, what works, what doesn't work, and why. And basically, these, again, it's part of open science and transferring knowledge as fast as possible to the community. We are in 2024, so for next year, organizing another challenge where instead we will use perspective patient data, so data collected via sensor and an app we have developed in the project for real patients which are in a trial. And we are going to organize a challenge on predicting scores and self-assessment of the patients from the data, also environmental data. And this, for example, is a way to embody citizen science, because we are now connecting the research side, the algorithmic side, with real patient data, with the feedback they provide us with the app and the interviews, and we are trying to mix everything together in order to improve the prediction. And again, all of this is based on sharing all the data with everybody in a way that makes them understandable, reusable, and accessible.
Thank you very much, Nicola. And I like also to cherry pick from your speech in relation to how important is the involvement of citizens who might be also patients in some of our research projects. So we have been talking about citizen science, and I know that Lorenzo here, that is representing Fondazione Bruno Kessler on one side, but on the other side, are really engaged, let's say, in local, apart from international projects, but also in local actions. How much is crucial the involvement of citizens for advancing knowledge in complex research questions, and how really we can try to let them speak to words that seems really apart, like research on one side and citizens on the other side.
Thank you. Thank you, Natalia, and thank you all for inviting me today. Well, as you mentioned, the point is very critical, because the involvement of citizens, it's pivotal. It's pivotal for advancing scientific knowledge and for addressing complex research questions. So the effective engagement of the citizen not only enhances the quality and the relevance of the research, but also fosters a sense of ownership and collaboration between the institutions. So to my understanding, to secure the active participation of citizens through the data altruism, I think that we have to consider at least three main issues. Starting from the fact that data altruism means that citizens choose to contribute to the science spontaneously. So this means that somehow they recognize that the potential benefit of using their data in a framework of a research. So the first thing to do is to show to me the advantages, the benefits that a citizen might have from making his or her own data available to research. So this means to adopt an approach that in the literature is known as a bench to bedside approach in research. That means, or translational research. That means to try to seek the gap between what the research is doing and the actual outputs of the research, in terms of more services, or in terms of making the current services more accessible, more sustainable, more convenient for the users. So my understanding is that we have to promote an approach where the citizen think that the more data I share with the scientific community, the more services I am likely to receive in the near future, or services with an improved quality. So this might imply also the adoption of novel scientific approaches, like real-world research, for instance, or citizen science approach, it was just mentioned, to make the citizen more involved, more active in the research field. But the second assumption is related to the transparency and accountability. To promote data altruism, researchers can build a trust by implementing robust data protection measures that were already mentioned before. And this is, to me, a key aspect, considering that data altruism is a voluntary sharing of personal health-related data. So it requires a transparent and comprehensive informed consent process, and also a process where the potential benefit and also potential risks are clearly explained to the participants. But the third issue is key as well, and it's a sort of governance approach, so an organizational asset that permits a proper engagement of the citizen within research projects. So a governance approach that can manage the chain, the connection between research and impact, and then can also manage the relation between researchers and citizens. And this is what we are doing actually here in the Promise of Trento through the Competence Center for Digital Health, Trentino Salute 4.0, the center where I work with other colleagues. What we are trying to do is to actually build a partnership between the autonomous province of Trento on one side, but also on the other side, the local healthcare trust and the Bruno Kessler Foundation, that is a research institute responsible for technological innovation in our province. So the idea is to embrace with this alliance different institutions under a public health governance approach to invite the citizens in collaborating into research. And we are using in particular a platform that is an electronic health record platform that is currently in place in our province, and that is accessed by almost the 50% of our population. And this platform is proved to be key in order to involve them, but also in order to promote the results that we are having out of the research based on their data. So I think that also this organizational and governance model is essential in promoting GDPR compliant data altruism process. Thank you.
Lorenzo, thank you so much for this insight and also, I mean, evidence of what has been done by the province of Trento, which is always quite at the forefront of engaging citizens and patients in local, but very important research and innovative activities. So citizens seems to play a focal role, and I know that also Jess is pretty much involved in this topic of the citizens empowerment, patients empowerment, that might also lead to better health outcomes and also to a major, let's say, sustainability of healthcare systems. The citizen, the patients, to be empowered must be educated, must be informed, and in this way, I mean, he can really embrace somehow the new opportunities that are coming from the healthcare innovation. Just which is your experience about the pivotal role of citizens and patients more empowered in managing and understanding, let's say, their health?
Thank you for that interesting question. I would like to talk about empowerment in terms of the role of adherence and patients' information on their medication, and how this knowledge of this can be used to better empower the patient and address the significant public health challenge which is associated with adherence or non-adherence. Non-adherence could lead to something, well, is estimated to be around 200,000 premature deaths annually, just in Europe alone. And if we empower patients, if we give them the information they need to better adhere to their treatment, then we can change this. I'm going to talk about specifically what we're doing in the Gravitate Health project, but I think the lessons we learn from there can be brought out into the wider health sphere. So what we're doing with improving adherence and empowering patients is by giving them better access to their information on their medication, to enable them not only to have better access, but to be able to better understand it and use that information in their treatment processes. If patients are better informed, then they are less likely to misuse their medication, and they're more likely to be aware of risks, which is a major win all round, I think, not just for the patient, but for the healthcare system in general. But to bring it back to what we're discussing today, which is the FAIR principles and how we see them being applied with adherence, I think we could start with the first findable. So if we can digitalize medicinal product information, instead of what a lot of us have now is this tiny piece of paper folded up small with even smaller print and a very difficult technical language often inside of our medicinal products, the packaging. And if we take that from the packaging and digitize it, make it findable then through the internet through portals, such as we are developing a platform within Gravitate Health and then associated apps. I mean, not just our app, but other apps. This means that information is much more findable. The next point, accessible. We could make it accessible precisely through the use of the internet and apps, etc., so that it's in your pocket, on your mobile phone, wherever you are. It doesn't have to just be the country where you're living. It could be when you're on holiday and you want to look something up, then you could also find product information there. So removing it from that piece of paper into the digital world would be a great step forward. And obviously associated with that is interoperability. To share information, it can be problematic if you don't have interoperable systems. You know, it becomes fragmented or even unavailable. But this can be resolved for the use of standards. For instance, in Gravitate Health, we are using the FHIR standard, but other standards are available, of course. But this common language would help to create alignment and avoid fragmentation. And then the last part of the FAIR principles, reusable. Well, of course, if this information is accessible on your phone or in your app, it can be found again and again. It can be shared as necessary with the relevant healthcare professionals, or even within your family with the carers and other members. So I'm aware time is running on, so I'll try and wrap up my answer. I think engagement of patients in their own health relies on actionable, understandable, relevant, reliable, and evidence-based information that meets their specific needs and their context. And as my colleagues were talking about previously, if we could do that, we could really bring some personalization towards the information that patients are accessing, and that will be the key to empowering patients, informing them with relevant information, personalized, and thus improve their health status, adverse events, and risk of disability or even death. Thank you.
Thank you very much, Jess. And yes, I think that we gave a very nice overview from very different angles also. So starting with the industry, then legal, then research, international research, local research, and then also the sustainability, the patient empowerment, the citizen empowerment to also support a more stable and self-sustainable healthcare system, so let's say in Europe. I see that the audience is pretty much interested to the discussion, and we have received a number of questions. One of these I think it's really interesting, because we are talking about this enormous amount of data that particularly the health sector is rich of, but we didn't talk about quality of data. So maybe quality is a nice question or topic to be analyzed. And how much do you think that the quality dimension can be considered in the FAIR data paradigm, for example? Christian, I would like to start with you, if you feel like.
Yes, happy to do that. I mean, quality is obviously absolutely essential, and as in any other areas, it's like very much like garbage in, garbage out in many aspects. And I think there are many big initiatives moving forward from that. And it's not only from a quality perspective, but also then quality can come at different levels. And one area which I personally believe is very important and has made significant changes in Europe is what was done with the Eden project, who drove the homopification of health data, where it's looking in improving the quality and do a quality assessment of the data on one stage, but also making the data comparable, speaking the same language in the OMOP common data format. And I truly believe with digitalization, where data is captured more and more automatically, consistently, we were looking more and more in complete data sets that are collected versus like manually collected data, which obviously is always associated with lack of data, and that leads to biases. So, I mean, the ones of us that wear things like Apple Watches, we all know that our data is collected 24/7 and is a consistent data set with a consistent high level of quality. So having said that, quality will only increase through digitalization and automated data capturing, but it's a key prerequisite. And I think this is also one of the key areas of concern related to real world evidence. What is the data quality behind it, where RCTs will remain to be the standard moving forward, where the quality is a key aspect to look into. So 2 aspects: better quality through digitalization, but then also making it connectivity through areas like OMOP. I think another area where this can be very easily seen, where it was digitalized from the start, is the DICOM data standard principle. In images, these kind of discussions do not exist because they can be taken as they are. And within the IDERA project, that is one of the first IHI projects, we are connecting data and we're using OMOP data, whilst the discussions are very different related to OMOP2 versus DICOM data. DICOM, we can use it from US, from Spain, from Finland, wherever. It's all consistent. With OMOP, we have different discussions. However, I believe the EHDS will also bring here enormous steps forward with consistency in data formats and standards to allow much better data quality. Just a couple of thoughts.
Thank you very much, Christian. Vasiliki, just given the ball has been, talking your field, just 2 words from your side.
Yes, from my side, I do not have many things to add because I think Christian's answer was more than complete. I would like to point out only that quality is actually a legal requirement at the same time. So it doesn't only have to do with how much you can use the data, but it also has to do with you are required by law to provide data that is of high quality, that does not include any biased information, of course, that is privacy friendly and everything. And indeed, the EHDS has that as a requirement. And this whole work that is being done in order to ensure interoperability and the provision of adequate metadata is what is making this whole system actually work and improve the quality in the long run. This is my very small contribution.
Thanks a lot, Vasiliki. Jess, I was seeing you noting a lot while both Christian and Vasiliki were talking. Would you like to add something on data quality?
I think that they have covered the main aspects very well. I just agree with these mechanisms that we need to have in place to ensure quality of the data. I mean, apart from anything else, to ensure we have trust from those who are providing their data, and the governance models, I think, which have been described also by Lorenzo, are an excellent way to achieve this. Thank you.
Thank you. And just here, I think that I have a question really for you. So,
yeah.
Which is related to the improving adherence, as adherence was at the core of your contribution to the panel discussion. And one of our audience members said information on medication for improving adherence should be more in scope of the relevant pharmacology information standards rather than on shared data for research.
Mm-hmm. Yes. It's not for research purposes, but it's more about giving patients access so that they are then able to manage their medication better themselves and then are more likely to adhere. That's the aim of what we're doing within our project, rather than a research aspect. I hope that answers the question.
Yes, thank you. So again, it's a matter of giving the right information at the right person at the right time to enhance knowledge, and then empower, and then adherence. I believe that that's the angle that we wanted to give now in our intervention before. And Nicola, Lorenzo, we have a couple of questions for you, I think, particularly, which is the importance of leveraging or putting together or implementing research on more than one data set, rather than really work, in silos in relation to the data that have been gathered. Nicola.
Okay, so thank you for the question. Obviously, working with more data sets is, especially from an algorithmic or let's say machine learning point of view, it's extremely important, because as anyone can understand, more data allow to improve the training and the accuracy of the algorithms. But it is also a fundamental part of the research process and the scientific process, because basically more data set, diverse data set, even a little bit heterogeneous data sets allow you to test the generalizability of your results, which is at the core of the scientific method. It's not only a matter of doing a predictor, I talk for my experience, doing a prediction algorithm, but it's also a matter of ensuring that it generalized beyond the data it has been trained on. And in this respect, having more data sets available, it's fundamental. Also, data sets prepared by others, so you are not playing, let's say, at home with the data you know better, but you are challenged with real world data from someone else. And basically, here is where the reusability of the data sets and the availability in the long term makes a difference. And the initiatives like the European Health Data Space or the European Open Science Cloud as a deposit of data can have a big impact.
Thank you. Lorenzo, would you add something from your side?
Well, yes, from my side, well, I can link here the experience that we are doing also in the province of Trento. So I can try to address the two questions about quality of data and also about silos. In the sense that in our case, what we are trying to do is, through the platform that I was mentioning before, is try to triangulate different sources of information with different level of quality. Because when we think about quality, it's not a 0-1 issue. It's something at different level of qualities. And we might accept a different level of qualities in relation to the type of data that we are using. So in case we use or triangulate the data from a laboratory, for instance, we might have high top quality information in terms of quality of the data. But when we are also triangulating these pieces of information with the patient-generated health data, we might have different levels of quality that can be at the same time important, because they are feeding the research by an additional strata of information that otherwise we will not be able to collect. So what we are trying to do, for instance, in the province of Trento through this platform is to actually put together different sources of information. So are trying to use different silos of information, of health-related information, from laboratory data to images, DICOM images that were mentioned before, but also adding all this big amount of information that the patient, him or herself, can add to the in an additional silos can add to the healthcare platform, and that can be used also for research purposes. So this way, I think, with accommodating for data of different qualities and data from different silos, we might produce even a greater knowledge by triangulating pieces of information that sometimes doesn't match together, but that they are still important to understand, for instance, the lifestyles of a patient, or for instance, the trajectory of the health or the disease of a patient, him or herself.
Thank you very much. Yeah, this was the other question that I had in my mind, and which is really about how important is the combination between very different data sources, let's say, or data coming from different sources, to better say, like data coming from the socioeconomic, let's say, point of view, or real world data. So really also environmental data, for example, and habits, and can this be translated somehow in reusable, combined metadata, quality metadata, let's say. Nicola, maybe on this you can add something. And also Christian,
Yes.
I think. Please, Nicola.
Yes. Yes, Natalia. One thing, what you are saying is absolutely right. One thing to keep in mind is that quality is a kind of continuous process and a goal. We cannot consider it for granted, even if we have all the tools in place, metadata, descriptions, interoperability, technologies, automatic data gathering, etc. But all these pieces must be managed and put together in a very careful way, and it is a continuous effort. Metadata, obviously, we have different silos or different systems interoperating. Metadata have probably different descriptions of the data. We know that ontologies help in mapping between different descriptions and bridging and coordinating everything, but it doesn't happen magically. You need really to have policies, to have standards, and even when you have them, you are not guaranteed if you are not an active part in this. I mean, you can, all of us know plugs and sockets around the world. It's not rocket science. We have a standard for each type of them, yet interoperating on this simple thing is still complicated. And this is where the quality of the data, the quality of the schema, the quality of the metadata, also the way in which you track the provenance of the data, how the data have been manipulated, changed for being passed from one system to another, the processing they have undergone. All these steps are fundamental. It's part of keeping record of the scientific workflow you have put in place for your algorithms, your inferences, your diagnosis, etc. So it is still a big challenge from a scientific and also technical and operational point of view.
Thank you, Nicola. Christian.
Yeah, I think the quality of the data is incredibly important and goes back to that one. And I very much like the statement about it's not a 0 or 1, but where do we are? And what are the standards we agree to, even if it's legally required? Because health data is captured in very different ways and formats. And that if you compare it, for example, to socioeconomic data, I think there's this much more consistent quality potentially about temperature, income, or such things. It's very, very clear. So one underlying principle is really the quality of the health data, and then also having the discussions with authorities related to that one, because we are talking a lot at the moment about the, rightly so, research arena, But if we want this to reach patients for decision making, there needs to be very clear standards, because it can't be that we have one algorithm that is developed on one data source leads to completely different outcomes on a different data source. We are on the way. It's a lot of learning that needs to be taken from there, and the combination of socioeconomic or environmental data, I think it's something which will be mind-blowing what kind of insights we can get from it. I mean, one historical example from my hometown Hamburg goes in a different direction, is from the 1970s to 80s, where one professor for lung cancer actually identified that his patients were either a certain group of population, they were actually building a major tunnel, or they were living in a certain area. Well, both of them had very high asbestos contamination due to the tunnel building, or the others that lived in an area was the area where the wind was blowing from an asbestos factory. I think that kind of combination that he did with, let's say, Sherlock Holmes-like insights is something modern data analysis will lead us to. So that's very much about the importance of connecting it. I think it's very, very crucial to be careful with the results and leveraging real-world research and using that much more as the basis for thorough randomized trials, for example, to say, hey, there's something awkward, what is happening, doing a proper analysis in a very clear research environments to then get these insights reconfirmed. I think that's absolutely essential. And I truly hope that with EHDS and increasing standards, increasing quality, that these kind of questions can be addressed, because from a technology perspective, I'm sure everything can be solved. But what is the information that we get in order to get the right conclusions? And we're talking about conclusions that are the most essential. It's about healthcare decision making, and it's a very, very high responsibility.
Yes, thank you so much. It's true that with technology, I mean, we can solve most of the problems, but obviously, if we don't have the right framework in place, we cannot go further. And given this, I would like to get back just a minute about the data altruism that also Lorenzo Gios introduced before. And I have a question from the audience again. Vasiliki, maybe you can help us in understanding a little bit better, which is stating that the Data Governance Act introduced too many bureaucratic burdens that might stop organizations to share data, to share data for free in particular. Is this correct, or is a preconception? Let's put it this way.
First of all, I would like to make this distinction that yes, the Data Governance Act includes this data altruism concept, and it's trying to promote the sharing of data. However, it is the EHDS that is the specific legislation for the sharing of health data. So the Data Governance Act is useful for sharing other types of data, but not so much for health data, because there is the EHDS in works, which is the specific legislation for this purpose. And if I may say so, I do not think that the Data Governance Act introduces such bureaucratic procedures. I think that in order to make sure that you can actually share data, and provided there needs to be a certain standard that these data need to meet, even when it comes to interoperability or quality or privacy requirements, because even separating data sets from like the personal data that is contained in it in order to not give away information about the subject is already difficult enough. And of course, I think that applying for a data permit in the HDS framework, of course, introduces some requirements as well. And it's a procedure that needs to be followed. And it's the same way in the Data Governance Act. There is just a different procedure for different type of data sets. But yeah, I think it could be worse.
Obviously. Okay, so before closing, we are almost there. Just 2 minutes to close this very interesting roundtable discussion. maybe a wishful thinking from each of you about what can be done, a little statement about what can be done to really enhance the secondary and let's say empower a secondary use of data in the healthcare field. Jess, maybe I can start with you.
How can we empower secondary use of data? I think if we follow the path that we've laid out here with the appropriate legislation, the appropriate governance models, and that through that ensuring trust. And if we can all trust, then it's going to work.
Perfect. Thank you. Lorenzo.
Well, from my side, well, I echo what the colleague just said by also adding the issue of multidisciplinarity. That is probably key in this perspective of enhancing a secondary use. Just researchers or scientists by themselves cannot do or can do something, but it's not enough. Citizens at the same time can do something, but it's not enough. Public health experts, IT experts, and so on can do something, but it's not enough. I think that we are showing, and there is an increase also awareness on that multidisciplinarity is probably the key aspect to support for reaching this goal.
Thank you. Nicola.
So I'm in full agreement with the colleagues, and maybe I add a little bit professorial angle. I think training people, which means students, researchers, practitioners for these cross-disciplinary and multidisciplinary skills is crucial. I can really tell me as a computer scientist is not enough. I can know the technical side, but I need to work with the medical doctors, with the patients, and understand them. And if we train the new generations, we don't have to start from scratch over and over each project, each community, and so on.
Thank you. Christian. You're muted, Christian. No?
Yeah. No,
okay,
no,
perfect.
yeah, perfect. So it's I can only reemphasize the trust aspect, because the trust will enable access to data. And I think if we are able as a community as a whole that we put the patient in the middle and say, look, what kind of data do we need in order to protect the patient, and have that as a core discussion and see what is best for the patient, versus where the discussion sometimes goes more in what is the best in order to maximize the protection of the data, which is the one of the patient. I think then we can really establish a trust level. And obviously trust can only establish, and I like very much what you said, Lorenzo, is what's in it for me. I mean, I take the analogy again of an Apple Watch or alike. You give your data because you get something back, and it's about that kind of give and take like anything in life. And that's the same thing with health data. And I truly believe if we give our health data in the right framework and as much as limited as anyhow possible, we can really drive healthcare in the future.
Thank you. And given the reference to the right framework, Vasiliki, last word for you.
The last word for me. I think that I would like to go back to the importance of research. Don't underestimate research in the field. Don't be afraid to engage with researchers and research projects, because in the end of the day, they are in a position to propose solutions, to hear your obstacles, hear what you're dealing with, what is difficult for you, and also engage with authorities, propose additional standards, collaborate with authorities in order to improve the legislation, and file for recommendations. So yes, don't underestimate the role of research. That's what I would like to close it with.
Thank you so much. And thank you so much for all of you. I think the discussion has been really smooth and heterogeneous. So I think that you gave a great contribution to this topic. Let me thank my co-moderator, Federica, Porcu, and we close the session here, and now there is the lunch break, and then the summit will get back in an hour. So thank you again, and have a very good afternoon. Bye.
Thank you all.
Thank you.
Bye.
Take care. Bye.